Sawadee Kop. Welcome to Break Time with Monte. Today's story, first, dengue vaccine as dengue fever spreads globally. World's first ever dengue vaccine now approved in 2 countries, Philippines and Mexico. Millions of deaths could be prevented with dengue, the world's fastest growing mosquito-borne disease. The Philippines became the first Asian country on Tuesday to approve the sale of the world's first ever dengue vaccine. Dengvaxia, manufactured by French pharmaceutical giant Sanofi, secured its first regulatory approval in Mexico a fortnight ago and is currently being reviewed by around 20 countries in Asia and Latin America, 2/3 of cases in Asia. It is hoped the drug could eventually help prevent millions of deaths from dengue, the world's fastest growing mosquito-borne disease. The World Health Organization, WHO, says as many as 400 million people are infected worldwide every year, and 2/3 are in Asia. Difficult problem for scientists. Scientists have long been stumped by dengue, which has 4 separate strains, forcing researchers to find a drug able to fight all of them at once. Clinical tests carried out on 40,000 people from 15 countries have found Dengvaxia can immunize 2/3 of people aged 9 years and older, rising to 93% more for the severe form of the disease, dengue hemorrhagic fever. It is also found to reduce the risk of hospitalization by 80%. Dengue can trigger a crippling fever, along with muscle and joint pain. There is no known cure for dengue, and children are especially at risk. The deadliest form of the disease kills 22,000 people a year, the WHO says. Dengue was once considered a disease of the tropics, endemic in only 9 countries. But globalization, urbanization, climate change, and jet travel have helped it to move into more temperate non-tropical zones. The WHO says cases of dengue have risen 30-fold over the last 50 years, with more than half of the world's population potentially at risk. The disease is now endemic in more than 100 countries. Sanofi's research and development R&D work took 20 years, costing more than 1.5 billion euros, 1.6 billion. Several million doses of the vaccine are ready to ship, and Sanofi expects annual production to reach 100 million doses in 2017, 2018, and 2019. Other pharmaceutical companies that are developing dengue vaccines include the U.S. firm Merck, Japan's Takeda, and Britain's GlaxoSmithKline. But Sanofi is ahead of the competition. Basic facts about dengue. Following are some basic facts. Dengue fever is a flu-like infection caused by the flavivirus in the same family as yellow fever. Dengue fever has 4 separate strains, Den 1, Den 2, Den 3, and Den 4. Once cured, the patient is protected for life, but only against the strain he was stricken by. Dengue is transmitted by several species of mosquito within the Aedes aegypti, which originate in Africa, but which are now present in all tropical and subtropical areas. Dengue can trigger a crippling fever along with headache, nausea, vomiting, muscle and joint pain, and skin rashes similar to the disease measles. The most severe form of the disease, dengue hemorrhagic fever, accounts for 1% of cases killing 22,000 people a year. The World Health Organization, WHO, says it results in bleeding and blood plasma leakage. It can be fatal, and particularly among children. The WHO says that 500,000 people are hospitalized by the illness every year, many of them children, of which around 2.5% die. There is currently no specific treatment for dengue fever. And now, today's vocabulary. Account for, annual, annually, approval, approve, at risk, basic, bleeding, born, case, climate change, clinical, competition, consider, crippling, cure, currently, dengue, disease, dose, endemic, especially, eventually, fact, fatal, firm, flu, fold, force, fortnight, globalization, headache, hospitalization, immunize, in particular, infection, joint, manufacture, mosquito, muscle, nausea, originate, pain, pharmaceutical, population, potentially, present, prevent, production, protect, rash, reduce, regulatory, research, researchers, result in, review, risk, secure, separate, severe, ship, similar, skin, species, specific, stricken, stumped, transmitted, treatment, trigger, tropical, tropics, urbanization, vaccine, virus, virus, vomit, vomit, zone, zone. That's today's story and vocabulary. You have a great day. I'll see you next time here on Break Time with Monte.